Hello, everybody, and welcome to the next episode of the Delivery Layer podcast. I'm so excited for this one. It's going to be really great. We've got on April Stiles and Roff-Marsh from Perspecta, which is a really interesting data company in healthcare. And we're going to talk a lot about data products, how to build data products, and how they impact funky industries like healthcare. April is the CEO and Bo is the CTO. So April, maybe you could just give us a little bit about Perspecta and your products and customers and what kind of data products you've got.
Yeah, no, happy to be here, Solomon. We are a healthcare technology company. Have a suite of products, and we really are subject matter experts when it comes to provider data. So the various products that we have in this space, really what we designed all of the products to be and to deliver are useful, being able to deliver provider data that was useful to our clients, actionable, and really important is revenue generating. So we sell our products in multiple markets in various lines of business. So today we're in the commercial healthcare, the government healthcare space, provider-sponsored health plans, hospital systems, workers' comp, and auto insurance. And ironically, that's a huge market and multiple markets. But ironically, many of the pain points that we solve for with provider data are virtually the same among every one of those market and healthcare buyers. With the 5 products, we have about 8 products, but the 5 products that are really focused on provider data are really focused on, again, using the data, making it actionable, and then making sure that is a provider data asset that can really grow the business and be revenue generating. Today, we are, as a healthcare technology company, we have a very robust roadmap. So the products that I talk about today are not the only products that we have, and we're constantly investing our time and our energy in expanding those products, adding more features and functionalities. We have a very robust roadmap. So
That's cool. And April, just for the people in the audience who might have not as much context, provider data here, you're talking about like actual like doctors and healthcare specialists. What do you mean by that?
Yeah, so that's a good question, Solomon, because provider data can mean a lot of different things to a lot of different people. So really, provider data would be that physicians and hospitals that you as a patient go and see that are part of your healthcare product, or if you were in an auto accident, those are providers that will accept your auto insurance, or if you have government healthcare. In addition to primary care and specialists and hospitals and facilities, we also solution products for pharmacy benefit management. So the pharmacy network that you can go to, the vision network you can go to, or the dental network. So basically anything that treats a person is the provider data that we're working with.
That's super, super interesting. And so maybe it would be great to jump into some of the products, because I can even imagine so many different ways that you could take this one data set and help people with it. And I'm sure you do a lot of that. So tell us more about the products.
Yeah. So one of the products that we all touch today is when you go online into your insurance product where you're getting benefits or you need services, you go online to look up a provider. And those are providers either that are part of your plan, or maybe you're shopping for auto insurance or workers' comp insurance, or you're shopping for health insurance. Those provider directories, that typically is vended to a third-party software program. So that's Perspecta. That's one of the products we play in that space. We offer in that space where you can, as a member of a health insurance product or a user, for instance, if you are an insurance carrier or adjuster that needs to find a medical provider to treat an injury or symptom or medical condition on behalf of someone, you would go into our tools, and there you can search and compare multiple providers. You might be searching or comparing providers based on someone's medical symptoms, their conditions, or the injuries that they need to be treated for. And in addition to that, we also have a transparency product that we embed within the directory that really enables users to go in there, or patients to go in there and say, Now I'm looking for a doctor. I need a cardiologist or I need an orthopod. What's it going to cost for me? Right? When I go in there, I want to know what's it going to cost if I need a knee surgery or I need a cardiac cath. So in addition to searching and comparing physicians, you could also be able to see how much your out-of-pocket expenditure would be. In that tool, we also have scoring. So you want to be able to see which providers might have better quality outcomes, might be scored by the insurance carrier with or through third parties. So we'll bring in that data. So not only are you looking for providers and the cost of them, but also how does that provider compare to their peers? So that's probably the one that most people, like anyone general public, has mostly interacted with. The next one we have is data cleansings. And when we say that, we're talking about provider data that drives these engines to search. So typically, if you're working with large entities like we are, they have a lot of data, millions and millions of records. There's obviously not millions and millions of providers, but there's a lot of providers that might have multiple offices. There might be hospitals with multiple campuses. So you have a lot of data that you have to manage. Not all of that data that we receive to populate into those provider directories are accurate. And it's really important to make sure that the data that goes into those search engines, that you're not sending a patient to a parking lot, or you're not sending that patient to a provider that's no longer walking the earth or no longer practicing. So another solution that we have in the market is that we have the ability through programmatic algorithms that we have is we can take that data and we can compare it to our data sets and say, you know what? This Dr. April Stiles is not at 123 Main Street. She's at 456 Street Road. So we'll go ahead and we'll cleanse the data, making sure it's clean and accurate, and then we load it into the applications or we share it back with the client. So again, useful data is very important to our clients to generate revenue for them. Another product that we have is what we call roster management. So think of it this way. There's tons of data that's coming into these insurance companies and these health plans, and it could be coming from their contracted providers. So it could be the hospitals are sending in data saying, hey, we have a new physician or we have a new campus that we just opened. Or medical practices are sending data saying we have a new physician's assistant or a nurse practitioner or this doctor retired and is replaced. In addition to medical and hospitals, there's the dental network data that's coming in. And then you have the vision practice for your eye exams. And then you have your pharmacies. The pharmacy, they may be going out of business, they may be consolidating, or they may be adding more locations. All of that data comes in all funky, awful format. No one standardizes a file, God forbid. So our clients are getting data from all these different entities, all of these different formats, and it's just mind-boggling because it could be hundreds of files they get on a daily basis, thousands, depending on how big they are. So in those cases, what do? They just basically take people that manually take a file that they get from a hospital system or a medical provider group, and they have to map that file or translate it through manual entry into a new file layout that their IT team says, put in this format, I can take it. Tons of data, lots of files. What we do is we come in and we say, no more manual work, no more fat fingering, no more issues. Let's go ahead and take that and programmatically, we have a program that will take those files and automatically translate that into a target layout that our clients can consume. So that eliminates manual work for them. That increases the speed of this very important data that they're receiving to get into their systems. And that also generates revenue for them, because if your directory now has a new provider that just came on board last week versus waiting 30, 60, 90 days for that data getting them. So very important. And the only solution they have today is really manual.
Yeah. It's crazy how much of the world, as much as in some areas there are all of these advanced data things happening, that future is not evenly distributed. And there's so many places in the world that are still on these antiquated, highly manual ways of doing things. And this is what you talked about is such an interesting way of looking at data products. One of the things that I've seen for a long time, and is one of the thesis of delivery layer, is that you could take the same data set and find a lot of different ways to effectively commercialize it. And you've got different flavors of that data that go to different customer archetypes, and they get a different value out of it. And the packaging of that data is really important. So just as even like a case study on monetizing data, like esoteric, what you would think is esoteric data, but is actually really valuable. Talk a little bit about like a healthcare directory and how does that drive ROI for clients, even though you wouldn't necessarily connect that to like a data product or a data business that could have a lot of impact.
Yeah, and I categorize it into two use cases for that, because you have the members and the consumers that utilize the product. And then you have our clients, the health plans and the insurance companies that are a buyer. So from the buyer's perspective, health plans and insurance companies, they can really be able to engage with their members or their policyholders or those patients to not only display the providers that are within that program, that member, but they can also promote certain providers over others. So if Dr. Solomon has 5 stars of quality versus Dr. April, they can really serve that up and share with that patient or that consumer to say, this provider is a better quality compared to their peers. And especially if you're going for surgery, right? So if someone's going in there and they're having a knee surgery, I may prefer to go to the practitioner that's done 300 of them in a year versus 4, right? So that's one way where, from our buyer's perspective, they want to make sure that their patients are happy and healthy and getting to the right provider for the right treatment. Another one is the use of the tool. Provider directory needs to be easy to use. It shouldn't be a Mensa test to get to a listing of providers. So easy to use, easy to understand, terminology that the regular person that's not in the industry can find a provider. And if you have a tool that is easy to use for your member population, then that's less phone calls into member services. And that directory is exposed to the provider community as well. So if the members and the providers can use the tool and answer the questions they have, then that's less calls into the call center, and that it decreases their operational expenses.
Yeah, that's super interesting.
With the Transparency and Coverage Act, now all of that data is exposed. So it also enables consumers, if they're more cost conscious, that they can go in and they can find providers that will have a less out-of-pocket expenditure for them, and they can really shop around and identify. And that's a tool that's built into the directory, and that's the health plan serving that up for them. So you have a lot of ways that it benefits both the members for getting good quality, maybe low-cost care, and for those buyers of ours that can expose all this information, be transparent about it. And the last piece of it is, if they are also cleansing the provider data that's in that tool, tons of legislation has been around and is always going to be around, and more to come from not only the federal government, but the state. The local governments have said, if you're going to offer an insurance product and people are going to buy insurance products based on not only cost of the product, but also what doctors are in there, you better have good, accurate data, because people are making buying decisions based on your directories. So in those cases, making sure that the data is accurate, you're not putting a doctor in there that's not part of the plan, that really does reduce better exposures for them in the public from a PR perspective. They're not going to get dinged by the Department of Insurance, and they're not going to get fined with the state and federal government to say you're selling something that's inaccurate, has inaccurate data that people are buying.
Yeah.
So multiple use cases of benefit to the end user and to the buyer as well.
Yeah, definitely. And not getting fined is always a good forcing function. Um,
In this
you
case,
know, but
bad PR is truly bad PR. You don't want to
exactly.
have a bad name in the market.
Yeah. So, Bo, on the tech side, obviously, the seeing data as an asset is a different lens to look at versus sort of traditional software engineering. So, from the technical side, what sort of thoughts do you have around building data products that might be helpful to other CTOs, or just interesting lessons on what it takes to build some of these products?
So I think I want to mention about healthcare industry. It's massively different from the rest of the industry with regulations, and there's also this fear about the handling of the data. The healthcare industry is obviously a hundreds years old industry with a lot of companies that are big, gigantic, and they've accumulated data for 100 years. And then now company like us, Perspecta, we're now dealing with their data to give them some benefit. That could be directory search, but also insights about their data and insights about the industry. So at the end of the day, our customers and their customers, which are like all these members of these insurance companies, they can get to the right answer, which is the right doctor to see and the series of doctors that they need to see. In healthcare, you think a lot about data accuracy, because without data accuracy, you cannot really send a patient to a right place. And you probably have, everybody has this experience. Like you go to a doctor's office and you don't know what floor this doctor is. So you end up looking at the directory to find where your doctor is. And sometimes the names are different on the directory in the building. So you have to spend some time to figure out, or sometimes you phone call and nobody answers. There's so many little things like that that affects accuracy. All the way to April's point, prices and then how much am I gonna pay, how much am I not gonna pay, all that stuff. So that data accuracy in the back is almost table stake for healthcare technology. And you have to bring something additional to the table that is basically insights. You mentioned, Solomon, the delivery layer is a great tool to show what actually this company is bringing to the table in addition to the accuracy of the data. So you slice that data that the company gave to a company like Perspecta, you slice it this way, you get this insight. You slice that way, you get these other insights. Because data is quite objective, and you can slice in many different ways to get many different insights that might help your members, that might help your next product that you want to put out in the market. So for CTO like me, accuracy, insight, but at the same time while protecting the privacy of the data, because at the end of the day, you're thinking about healthcare data, that's physicians' data, their PII, but also there are patients' data coming in, which is basically almost like the, what is it? The basis of the fear in this industry, that you cannot expose patients' data in any way that is not allowed. And the confidentiality of the company's data and what they're doing. Many times we see this a lot in a lot of our clients, that they come up with their own scores of physicians and of treatment and all these things. And then they kind of rate physicians actually on their own. There are companies just doing that, but we see more and more insurance companies doing their own machine learning, coming up with the scores. So that information is confidential to them. I mean, it's very valuable asset to them, but they share that with us, with a company like Perspecta, because we need to curate their data and eventually provide insights to their members and the customer. So for CTO like us, it's literally accuracy and the ability to give insights that the customers cannot have, the industries cannot have, while protecting privacy and confidentiality at the highest level.
That's
That
super
I would.
interesting. And I love how you've got this sort of balance between, yes, the data is private and has many security implications, and also the purpose of data is to be used to help people. And so you have to build effective systems to get both of those at the same time and to balance the security with the actual impact of the data. And just in terms of impact of data and healthcare industry, Bo, you mentioned it. A lot of these healthcare companies are 100 years old. And I don't even want to think about how some of that data from 80 or 90 years ago is stored. I don't know, maybe they microfilmed it at some point in a modernization effort in the 40s, who knows? So I guess, April, Bo, as you think about like where data comes into these very old companies, these very big companies, to what degree are they trying to use data as a transformation project? To what degree is that sort of, does data play a role there within healthcare?
Yeah. So one of the things that we all have to recognize is that these insurance companies and these healthcare organizations, their biggest asset is their provider data. Because if they didn't have provider data or medical providers, vision, dental, pharmacy providers to accept whatever insurance product sits on top of that data, what's the product they have? So as much as the data is important, to your point, so many legacy systems, that one of the biggest challenges that organizations have is they can only grow based on that data asset. Can they enter new markets? Do they have the providers, and do they have the breadth of the market to enter a new market and create new products, or create new products on the existing market? The rub that they have is similar to what Bo said. Tons of data, to what you said, Solomon, all on these different legacy applications that are older than maybe all of us. And the business leaders really need insight into, how big is my data set? How big is my asset? Is it big enough to enter into this market? What do I have to do to grow a product? So what we've done is really, to what Bo was saying, is to provide the business insights into that data. And we partner with you, Solomon, and Delivery Layer to help us expose that in dashboard and into reports, but mostly dashboards, so that the business leaders can see how much data they have. They can see if their asset can be divvied up to expand or grow or transform their business. And that's their revenue producing. That's how they're going to monetize. So in order to monetize that asset, they got to understand what it is, how big is it, where are my weaknesses, and where are my strengths. And legacy, what they used to do before Perspecta and companies like Perspecta, and with our partnership with Delivery Layer, is they were completely dependent on IT. Run me this report. How many providers do I have in California? Okay, great. That's a lot, but is that primary care physicians? Is that how many cardiologists have? They were reacting and getting reports and managing spreadsheets, and that's not strategic at all. So to effectively to invest in their product and monetize that asset, they can't be dependent on technology groups. They have the business themselves, have to have insight. They have to have dashboards so that they can really see, how do we make this thing and what can we do, and make plans for the future.
Yeah,
No.
that's super interesting. And it sounds like it's not just operational day-to-day focus, but also even business model transformation focus.
There's a whole thing in the market called network adequacy. And so you have to make sure, if you have a product, that you have enough providers to support that product. 3-4 years ago, IT, run me a report. I don't know what I got, because my data is in 18 different systems. And oh, by the way, they don't talk to one another. So even better. So I get 18 different reports, and then I have someone play it in Excel spreadsheets trying to figure that out.
I need to
Many
add
years.
something to that. It's very interesting. Like in the industry, there's this thing, there's this product we have it too, data cleansing. And it's basically based on this hundreds years old data. And then they wanted to know how accurate this is. And I think it's very known in the industry. It's like, surprisingly, to those people who own that data, they don't even know how accurate their data is. Many times they don't even know what's in there. What's in my data? They want to do something about it. They don't know. And it turned out that it's about 40 if they managed it very well. But about 60% of the time the data is not accurate. So in a 10, say 6 physicians information out of 10, it's just something wrong with it. Going back to insight, these companies want to do something about it, but without even knowing what they have, how accurate, how big it is, what I can do about it. It's just difficult for them. I think that's one of the factors of why healthcare industry moves so slowly. It takes time for companies to figure out what they have. And to figure out, they need help from so many different entities. It could be their IT, could be their technology team, could be somebody else like Perspecta. There should be the translator of their own data so they can understand. So like with partnership with Solomon, we're really trying to give the transparency of their data, some window into their data so they know about their data, but at the same time being a translator. So we we understand their data a little better than themselves because we have seen so many companies' data, clients' data. So we're doing that because this is not something that we tried to do in the very beginning, but we realized that, this industry really needs a translator. So that's what we're doing with some of our products, that trying to give transparency so they can land in the insight land that can really help them.
Yeah, that's great. And it's fun. I was thinking of 2 stories as you were sharing. The first one was from my time working inside a really big bureaucratic company where we really needed this one SQL query that would probably take somebody 20 minutes to write and run. And and this was like for a revenue generating, like important client, like we just needed but it was in another division. And they told me that I would need to wait 3 quarters until somebody internally would have enough time and I knew that it was a reasonably simple query. And so I was just like, I'm not waiting 9 months for this one big client renewal to get it's like that. And I can only imagine what it's like sometimes for the people inside these big companies with similar mindset type of key support for this, where they're like, oh, I need to get data from these 10 systems. It's good luck. That's going to take you like 4 years before you get on everybody's roadmap. So it's probably an underappreciated thing. And then, Bo, when you were talking about the data accuracy, it's interesting because I find that, and I think maybe after this, I'd love to deep dive into data accuracy because I'm sure you have a lot of stories and really interesting things to share. One of the flips that I think that I learned when I started running data products is that as a data person, you like to judge accuracy on as small of a number of errors over as big of a number as possible. So it's, if we generated 100,000 data points and we only had 1,000 errors, that's like one out of 100. But if it turns out that every single customer record has one error somewhere, that's actually 100% error rate when like someone's using your product, because every single thing that they look at has an error somewhere. Yeah, sure, maybe not every phone number is wrong, but it's either the phone number or the address or the name or the this or the. So talk to me about the level of accuracy. There's a big disconnect, the level of accuracy you really need for a product versus the level of accuracy that people think. Let's just talk about that, because I'm sure you have a lot to say about that.
Bo, you want me to go first?
Oh yeah, go first. Go first.
I think so I would say that the level of accuracy is dependent on the product. So if we just take the directory, and the directory, you just got to make sure A, is the person still breathing? B, are they still a participant in the program? Is their name, address, telephone number, their office information correct? You're not sending them to a P.O. box. You're not sending them to the hospital that they have admitting privileges is. You want to make sure that the location in that directory is a rendering location. So if it's provider directory, you want to make sure the profile of the individual or the facility is correct. When you get into credentialing systems or claim systems, the accuracy of the data is different, right? For a claim system, you want to make sure you have the right billing information. You want to make sure you can tie the parent-child relationship or grandparent-parent-child relationship together. So that data accuracy is different. I will say it's funny. There's two things with data accuracy. It's not just whether the providers are still their data, their location data, and that they're still practicing, but also duplication of data is a huge problem. So one of those things that we also measure is, are the phone numbers, address, specialty, are they licensed in the state? Can they practice? But when I look at your data set and I see you have Dr. April Stiles at the same address listed 5 times, your data set can be condensed significantly to something that's really, truly accurate. For us, accuracy really is going to be, what is the product that we're cleansing to put the data in? Because if it's claims, maybe you don't care about gender, right? But if it's a directory, you care about gender, or you care about county, you care about cultural competency, you care about office hours. So at Perspecta, we really understand the use case when working with that client and what application we're interacting with. We might be interacting with all of them. Because one of the other things is the data in these insurance companies, all the data sits in silos in these applications, and they don't talk to one another. So one of the other products that Perspecta has is what's called a provider data management application. So we look at it like we're the ATM. We'll pull data out of those legacy applications because they don't talk to one another and they're not sharing data. So internally, they're like, we don't know which system has the best accurate data or the most recently updated. So we will pull that data out, we'll consolidate it, we'll organize it, we'll display it and have a UX that they can go in. Then we also push it back out so that they have, during that process, we'll cleanse the data and we'll also supplement the data with anything that's seeing missing. If you don't have a telephone number, we'll give you a telephone number because you're going to need that. If you don't have a billing address, we'll give you that too, because guess what? You're going to need that to pay claims. But then we push it back to all those legacy applications they have so that those organizations now have good quality, it have data, accurate, they have data integrity, and now they have data governance. So accuracy can mean a lot just depending on the application that we're interacting with. But Bo, you might have some other comment on data accuracy too.
April nailed it. So from technology perspective, these days everybody uses AI, machine learning, and all that. And there are companies out there just purely doing machine learning for data accuracy. And we're not one of them. We're not doing machine learning entirely just to get to that accuracy level. Because when you think of almost the first principles of these things, right? There is no way that anybody would be able to get to 100% accuracy on provider data, period. There are companies doing, or 96% accurate. And then to Solomon, your point, okay, so you did a sample testing. So you did 10 and like 9 of them were accurate. So you're going to call that 90%. That literally happens in almost every company right now in the industry. Well, at least in Perspecta, looking at so much data coming from so many different clients, we noticed that not every single data attribute in the source file or their output file is equally important. it really depends on their use case and their business case. So making sure that those things that they really care, they are accurate. And when you're doing accuracy, we might actually do real old ways of actually making a phone call to them and verify, because they're physical doctors and they're alive. So we actually
We hope they're
use
alive.
multiple ways.
Some of them in there aren't. Some of the providers in those towns are
not-
little.
Mostly alive.
That is also true. Yeah, so think we actually go by the business values, because it comes from that fact that customers might not know everything about their data, and they don't even know what's in there, what's not in there. So telling us and sharing with us as a partner what's really important, what they really want to do, and then we back that up with the accurate data that we can come up with for those attributes in their data. And this has been working very well for us and to our customers as well, because sure, AI is out there, it's everywhere now. But when you think of accuracy, most of the advancement that's happening in the AI world is getting closer to more of a heuristic method, right? Think about Optimus, Tesla bot. They are really evolving to look and act more like human and make decisions like humans. And humans don't make decisions accurately all the time. So when you think of provider data and the accuracy of it, it's a really deterministic thing. Like it's accurate or not accurate. So I think this is like for your listeners who are in the market to shop. If accuracy is 100% depending on machine learning, you're probably not going to really get the outcome that you want. You probably need to consider a lot of other factors as well, like use cases and what attributes and the value of it, all that stuff. Yeah, I'll just end there.
No, it's so true. In my division at Nielsen, we had a number of like machine learning only upstarts, and we used a lot of machine learning models, but we had a lot of people come in and say you could do the same quality, the same everything. And it's like we had 1,000-person operations team that was ensuring that our data was at a quality that the market could use for real business decisions, and we've invested more than all of these companies in machine learning models. And we just understand the limitation to the point that we also needed this extra work. And I've lived that situation. And over time, frankly, the market saw that a lot of these had challenges. But AI, when it comes to like labeling and data quality, is only one part of the AI conversation. And so maybe for this sort of, well, at the end, we can't do a podcast episode without talking about like the Gen AI innovation stuff going on in data. We couldn't do that. It's against the rules. It's a big question, but how do you see some of the sort of Gen AI agents, different workflows impacting the need for data, the need for data quality? Like, how are you seeing that play out?
I'll go first about from a technology perspective. So from a business perspective, we see that AI can be at the consumer level. Let's help a consumer or a patient find a provider through AI. Let's help them search. Let's serve them up the right providers based on their conditions or their injury or illnesses. So in our tools, we see that AI is very helpful for them. What we're also seeing is tons of security assessments around AI. And going back to the asset of these companies being provider data, there is an intrigue on how are you going to embed in AI? But wait, what are you going to do? And don't jack up our data. Because when we're putting our methodologies and algorithms on data, we're transferring that data back. So it's a lot of, we're very intrigued in AI, but at an arm's length until we truly can understand how it impacts our asset. So be very cautious, Perspecta and others, on how you use it. So where there have been When you sign your contracts with HIPAA and PHI and PII and all these different security, AI is a whole nother security assessment that has emerged in the last year that people are talking about it and they want components of it. And we're embedding components of it in our technology that's more consumer facing. But when we get to the data, there is AI restrictions we do. And I'll let Bo elaborate a little bit more.
Yeah, that is very true. Most of our clients at this point want to know what kind of AI we're using on the product or any way possible. They also want to know how their data is directly used in machine learning models. And yesterday I was reviewing one and they wanted us to list every single variable that's used in every single model, literally. And they also wanted to explain on us to explain, okay, this variable, how it impacted the output of the model. Like literally just they just want to know in and out of the model and everything the model does. So that's we can see how companies are curious about this AI and then they're very cautious about their data being used. And they don't want to be dinged in any way possible by whatever regulations there is right now or that's coming their way. So they internally at Perspecta with all those inquiries about security and AI, that kind of gives more weight towards it, how like being very transparent about how we're doing things. Because when you think of in old ways, things like machine learning models can be very valuable asset to the company who came up with it. Opening it up or explaining the algorithm of it, or especially that feature engineering, how you did it, just telling everybody that is really secret sauce that you're opening up. But in healthcare industry, with the level of confidentiality of the data that they're sharing with us, it sounds like it might be necessary for them to actually understand what's going on with their data and what they're getting out of it, especially if it's beneficial to them. So figuring out how to share this core knowledge with them so enough for them to understand the benefit of it is one thing. I think it's almost a homework of this industry, the tech company's homework in this industry, because to April's point, everybody's very careful, cautious, almost fearful of using AI at the moment.
Super interesting and not necessarily surprising to hear from healthcare. And I feel like at some point, maybe the switch flips and they realize, oh, all of these massive processes that we have, we can use AI there. And then the data becomes even more valuable for them to pull into those workflows.
If I
But
was in their shoes, I would be cautious too.
of course,
It's like the
of
black
course.
box. And we're really sensitive to our clients and our buyers because they've inherited legacy systems. They've inherited these processes and they really are constrained with what they can do. And we're appreciative for them to buy outside of the organization for solutions. But it would be hard shoes to walk in. And it's just the nature of the beast. The pain point that they have is across the board. Nobody has, if you're a startup, then you don't have these problems. But
Sure.
but some of these bigger entities out there, they got to work around what they have. And it's a challenge. And we're happy that we're able to be a partner. We're subject matter experts in provider data. A lot of us started our career on that side of the fence and building networks and contracting with providers. So we understand the layers and levels of data and formats, multiple files, and aggregating that data is really difficult. And our clients don't have the data architecture to do it. They just don't. So they really do need to look for a partner that understands that space, that's been in that space, that has that SME experience, and we can come and solution something that makes sense.
Yeah. Totally. I love it. And one of my favorite things to say, because I have this professional development program that I do with some data people, and I talk a lot about data work. And one of my favorite phrases, if it was easy, they wouldn't need you. So that's it. If it was easy, they wouldn't need you. April, Bo, thank you both so much for joining. For anybody that wants to learn more about Perspecta, or if they want to follow you along online, where should they find you?
At goperspecta.com.
All right.
Find Bo, you can connect with me. You can read all about our company and our history and the products we have here. We'd be happy to entertain any questions or comments or conversation.
Cool. All right. Goperspective.com and have a great day. Thanks for joining. This is fun conversation.